For years, doctors have been exploring new methods to fix the hearts of our smallest and most vulnerable patients. Babies with severe heart issues often struggle to make it to term. So how can doctors fix the issue if just being born is a gamble? In this case, they performed the procedure in utero.
When we went to the 20-week scan, I was really excited to see the baby and see how much he's grown. During the scan, they look at all the organs, all the bones, and they like to get pictures of the heart. The doctor came in, they saw some problems with the blood flow, and she said, we need to send you over to the cardiologist.
It's going to be no big deal, but that's not what it turned out to be.
He was developing hypoplastic left heart syndrome, which is a heart disease in which the left side of the heart does not develop. He also had a severe leakage of one of the heart valves.
One of the worst possible combinations of problems, blockage of one valve and severe leakage of another.
This is extremely rare. The largest report had only 21 patients in it, and only 2 of those patients survived to be 6 months of age. So if we could intervene in fetal life, that may be Lorenzo's only hope of surviving.
It's a tough discussion to have with the family. Either your baby is going to have a 0% chance of survival or a 20% chance of survival if we do this procedure. And by the way, when we do this procedure, there's a 20% chance that the fetus will die during the procedure.
We were devastated, we were upset.
All we really wanted at that point was to meet our child and hold him, have a few hours and try to make that special.
The goal of the procedure is to open up the valve and allow the heart to develop with less blockage.
We take a small needle through the mother's abdomen, into the uterus, and through the chest wall of the fetus, and directly into the heart.
And then Dr. Armstrong passes a wire that has a balloon on the end of it across the aortic valve.
We inflate the tiny balloon to open up the aortic valve. If the babies survive, almost all of them need surgery before they're discharged.
We were just waiting with bated breath after the procedure. We were terrified.
All we could do is watch and wait. The part I'll never forget is as they were wheeling me out, every doctor on that team was smiling. They could already see that the blood was flowing the correct way out of the aortic arch. That was our first good news.
Luckily for us, every week got a little bit better.
The day of delivery, they brought him out and they let me hold him to get that chance that I didn't know if I would ever get.
It's truly a miracle that Lorenzo is here and doing so well. We always will be in debt to this team and what they have done.
Wow. Incredible story.
Truly incredible, and in a doctor's exclusive, please welcome Heather, Anthony, and baby Lorenzo to the show.
Welcome.
We are so happy to see baby Lorenzo in your arms, and watching that tape piece and watching the intricacy of that procedure performed, take us back to that day you were actually having that surgery performed, if you will.
We were very nervous, to have the surgery. Obviously, as you heard, it was a very risky procedure. We didn't have a lot of guarantees as far as how it was going to turn out, and it's not something that they've done a lot. So definitely, a lot of nerves. Really, we just wanted to meet him, and we wanted to hold him, and we were so lucky that the procedure was successful. And, we continued to have follow-ups after the procedure, and each week he looked a little bit better and a little bit better until, one day we left the doctor, and I looked at Anthony and I said, wow, I go, we went from discussions about what things did we want to do with him in whatever short amount of time that we may be able to spend with him, to talking with the doctors about what sports he may or may not be able to play in high school.